Our second recipient this morning is Dr. James Shaw, representing the Lackey Free Clinic Volunteer Medical Practitioner Recruitment Program. Good morning, Jim.
Good morning, Sandy.
Could you tell us about the Lackey Free Clinic and your role in it?
The clinic started in 1995 in the Rising Sun Baptist Church when my wife and I decided to answer a calling to serve the poor. Things were pretty tough in those days because not many patients came to see us. But we persevered one night a week, and eventually we were able in 2003 to get our own building just down the road a bit, and then things really took off. And we became a 5-day-a-week clinic eventually, and we now serve over 4,000 patients on our rolls and 7,500 patient visits last year compared to less than 100 in our first year.
Wow. So as your patient population has grown, the work of your clinic has grown as well. Can you tell us about what services, health-related services you cover in your clinic?
We're primarily a family practice ministry, so that we address chronic problems like asthma, diabetes, high blood pressure, heart problems. But we also have been able over the years to set up and get monthly subspecialty clinics, 8 of them, that include everything from orthopedic surgery down to rheumatology and pulmonary disease. And so our patients don't have to go out to physicians' offices to see specialists. They can see them in the clinic. And that's very unusual in the free clinic setting to have that many clinics actually on site.
That is unusual. And how do you recruit your doctors and nurse practitioners to come into your clinic?
Yeah, that's been an interesting and long-standing process. If you go back to the early days, I practiced for 20 years based at Riverside Hospital. So I knew virtually all the doctors that practiced there. And I would make little hits in the hallway and ask somebody to come out and help. And gradually we accumulated a certain number of doctors. So the first part of it was my direct interaction with friends, and at later times, people that I'd helped them with difficult patients, and I leaned on their friendship and said, you know, I need your help, have it coming out. And so that it grew, and then the second phase kind of hit where the word of mouth was out about the clinic. And since we are a faith-based clinic, and that's why my wife and I started the ministry in the first place, was to answer a calling from God, we made contact with lots and lots of churches, and lots of physicians and nurse practitioners attend church on the peninsula. And when the word got out, I didn't even have to call people. People started calling us. So now we have a large number of volunteer physicians and nurse practitioners coming because their church has told them about it and they want to serve. The last part is we now have enough people in the volunteer base, which is 55 physicians and nurse practitioners. I don't think hardly anybody else in the state has that many. Now our doctors who work with are inviting their colleagues to come in, and we're getting them in that third method, just based on word of mouth and the good experience they all have there. I should add that it's not all Shaw, because we have an exceptional volunteer recruiting person. Her name is Kim Spencer, and part of the thing with volunteers is you have to sort of coddle them along and be nice to them and make them feel special by coming out to help. And that's Kim's job, and she does a great job. So everybody loves the feeling of helping, and our modus operandi, other than just giving exceptional or good medical care, is these people are downtrodden. They've been turned out of ERs, they've been turned out of offices because they can't pay, and so we give them the exact opposite experience. We make them feel loved. There's something called a lackey hug, where everybody gets hugged by a nurse and sometimes by me, by a physician, and they really like coming back.
That's good. You mentioned the economic downturn and how many people have been turned away. That makes your volunteers that much more important.
Right.
Have you seen any other impact the economy has had on your clinic?
Well, the biggest thing we've seen is we've had to turn away more patients for registration. We have to limit because with the numbers of appointments, we can only take so many patients. Right now, we're taking approximately 60 new patients a month, and in the spring, and we haven't tracked it through the latter part of the summer, we were turning away 100 people a month that needed our services. One of the things we're now beginning to work on is a way to lower visit times for our appointment clinics, and in that way see more patients. And we're trying to implement that in the next several months.
It's obvious your clinic has had a tremendous impact on the community. Are there steps that you could recommend to other organizations so that they could replicate the success you've had with the Lackey-Free Clinic?
Yeah, going back to the volunteer thing, I think that is absolutely key. You cannot give the volume of services we give, and last year was $6.2 million worth of services, direct services, without volunteers and without happy volunteers. It's tough enough getting a volunteer to commit regularly, but unless you make it a good experience and make them feel good about what they're doing and enjoy being there, they're not going to come back. So you've got to keep your volunteers happy.
Okay. Is there anything else you'd like to tell us about the Lackey-Free Clinic and your medical practitioner recruitment program?
Yeah. Well, if anybody is out there and would like to volunteer, especially if they're a doctor, a nurse practitioner, a physician's assistant, I'd love to talk to them. The second thing I wanted to bring up is about the Williamsburg Community Health Foundation, and that is we are part of what's called the Chronic Care Initiative, which involves 4 or 5 free clinics, the Colonial Services Board, and a couple other entities. And this is a cutting-edge group because we meet once a month and we are able to provide each other with breakthroughs and new ways of doing things that we have discovered and are able to pass it on to the other people in that facility. And we've watched everybody, every clinic, every health-related organization in that group grow during this process. So I wanted to give Renee and the group a lot of credit for that, that chronic care initiative because it's top-notch.
Thank you, Jim, for all you and your staff do.
Thank you so much, Sandy.
You're welcome.